notifications. That email list is the best way to stay up to date. And if you're not added and would like to be added, please email media_info@state.co.us. And today, to help answer some of your questions, we have Scott Bookman, Incident Commander for CDPHE COVID Response, Mike Willis, the Director of the Emergency Operations Center, and Patty Salazar, the Executive Director of the Colorado Department of Regulatory Agencies. And to get started, I'll have each person state their name and spell their name and also restate their title for you. And then we'll start asking questions. So.
This is Scott Bookman, SCOTTBOOKMAN, Incident Commander for CDPHE.
Mike Willis, WILLIS, Director of the Office of Emergency Management.
This is Patty Salazar, PATTYSALAZAR, Executive Director for the Department of Regulatory Agencies.
All right, so this first question is from Jesus Carswell of Univision News. The community is confused about which order to follow, the governor or the local authorities. Must not stay home. What do you think about the mayors who ordered to stay at home?
Thanks, it's Mike Willis. The way to view that is that the governor's state executive order sets the baseline, and anything less restrictive is illegal. However, local authorities do have the authority to impose more restrictive guidelines upon their jurisdictions. And so if your jurisdiction, a mayor or whomever in your jurisdiction has imposed greater or more restrictive measures, it's important to follow those. If they have not, then it's important to follow the state guidance and the state executive order.
This question is from Taylor Summers with NBC News Radio. Colorado has joined the Western States Pact with Washington, Oregon, California, and Nevada. What made joining this group of states more attractive option than potentially forming a separate group with neighboring states like Utah, Wyoming, Nebraska, and so
This is Scott Bookman. I think that's a question best sent to the governor's office. We look for collaboration in any number of different areas. The specifics, but I think the specifics need to be answered by the governor's office.
This question is from Michael DeYoana with KUNC Public Radio. Do all the nursing homes and facilities have the personal protective equipment needed to prevent staff members from spreading coronavirus to patients?
That's Mike Willis. PPE is strained throughout the state in all kinds of facilities, including nursing homes, long-term care facilities, skilled nursing facilities. They are all under great stress, and they are following the standards of care in order to conserve their PPE. We're doing everything we can, including significant cooperation with the federal government to push PPE to those facilities, but it is very strained right now.
This question is from Jesse Paul with the Colorado Sun. The Safer at Home public health order includes a provision that Coloradans not travel more than 10 miles from their homes to recreate. Is that an order or guidance? If it's an order, what are the penalties for violating the order? How will it be enforced?
Mike Willis with the Office of Emergency Management. It's really important to understand we really need everyone to do the right thing, and traveling beyond your community and potentially spreading this to other communities is a really counterproductive thing to do. We don't want to get into this big thing about enforcing. We're just asking people to do the right thing, to protect their neighbors, to protect their vulnerable populations, protect the people we care about. So we're asking that people stay close to their homes and not travel. We've heard the governor say, it's not a vacation. This isn't the time to grab your family and run up to the mountains and potentially spread it to other communities. So we do ask that you stay close to home.
This next question is from, it looks like someone might be sharing their screen. So this next question is from Fox 31. Colorado is only doing about 1,000 tests per day, and we need to do over 16,000 per day. Are the figures correct? How many tests are we doing per day, and how many should we be doing?
This is Scott Bookman. We are doing closer to 2,000 to 3,000 tests per day, depending on availability at this time. We have set an ambitious goal of doing approximately 10,000 tests per day when we get up to our peak testing capacity. We are doing all that we can to work with our local partners, our healthcare partners, and the federal government to ensure that we have access to the adequate testing for the state.
This question is from John Herrick with the Colorado Independent. What guidance, if any, has CDPHE given to halfway house operators for how to manage COVID-19? And what steps, if any, is CDPHE taking to control the spread of COVID-19 in these facilities?
This is Scott Bookman. I can't speak specifically to halfway houses. We do know that more globally, congregate housing of any type is a challenge in this environment, and our guidance is about keeping social distancing, the wearing of masks, ensuring good hygiene practices, and then when people are identified to be COVID positive, cohorting of people to do everything that we can to reduce transmission is important in all facilities like this.
This question is from Jessica Porter with Denver 7. How many contact tracers does CDPHE have? Are you hiring more, and how many does the department need?
This is Scott Bookman. So we are currently working on hiring an additional 50 epidemiologists. We are looking at a number of different technology-based strategies that will allow the work of those epidemiologists to go farther. And then we are looking for volunteers and others who may be able to help us with contact tracing. We would encourage anybody who wants to help to go to helpcoloradonow.org so that we can continue to build this workforce out.
This question is from Blair Miller with Denver 7. In recent mass testing done at prisons in the Midwest, up to 90% of COVID-19 positive individuals were asymptomatic, according to a Reuters report. What percentage of people does CDPHE believe to be asymptomatic throughout their illness? How does that affect screening and testing measures as they're scaled up?
This is Scott Bookman. I can't speak to those specific numbers of 90%. The more that we learn about this virus, the greater understanding we are developing about asymptomatic transmission. It is certainly a driver of our goal to start doing more targeted testing in congregate living facilities like skilled nursing facilities, prisons, and other areas where we really need to be doing asymptomatic testing to stop spread before it becomes apparent.
This question is from Kyle Clark with 9 News. If we're not testing widely, hospitalizations may be our best indication about the spread of the virus. Since hospitalizations lag infections by several weeks, how are we able to lift restrictions in a 2 to 3 week increments when our best indicator lags by several weeks?
Kyle, it's Mike Willis. Yeah, there's a lot of hard decisions that have to be made with information that may not be as complete as we'd like. We wrestle with that kind of thing every day, and so appreciate your observations on that, and just to know that we work really hard to try to do the best thing for Colorado.
This next question is from Vinny Del Judith at Bloomberg News. What are the latest estimates for virus deaths this year in Colorado?
This is Scott Bookman. We don't have any future estimates at this time.
This is from Ellis Arnold at Colorado Community Media. Earlier last week, it seemed that the governor was saying that the safer at home phase of social distancing will last for months. Yesterday, sounded like he was saying it would last through May and be modified in June. How soon does the state expect the third social distancing phase, protect our neighbors, to happen, when people can attend large stadium sporting events and other activities that are not currently allowed?
Yeah, Mike Willis. We definitely have to take this incrementally, and that's why the governor has these stay the safer at home order in place for the next 30 or so days, but we have to evaluate how the virus evolves, and we have to have a better understanding of where we stand in 30 days before we can make good decisions about what's next. And I think we just have to be prepared as Coloradans for it to change and shift as the virus manifests itself in different ways. This isn't going to be some linear process as we go through it. The governor works really hard to understand the modeling and to compare that to the facts known at the time. And so we will be in a constant iterative reevaluation of the situation in the state to make the best decisions to keep Coloradans safe.
This next question is from Fox 31 Denver. There's two questions. The first one was about how many contact tracers have we hired and do we need? And I think we've already answered that. The next question is, does Colorado track a daily influx of hospitalizations? Seems like CDPHE website shows cumulative number of hospitalizations and daily discharges, but not daily hospitalizations. Is there a way to get that?
This is Scott Bookman. We can look and see if we can make that data available on our website. So let me take that back and we'll go forward.
This question is from Jessica Porter with Denver 7. How much has CDPHE spent on the coronavirus pandemic?
That's Mike Willis, Office of Emergency Management. Right now, we think we've spent approximately $70 million. That fluctuates every day, either through the cancellation of orders that may not come to fruition. If we order PPE and the supplier can't deliver it, we cancel those orders so the number goes down. Or we find opportunities to purchase PPE or other equipment necessary to help keep Coloradans safe. The number will go up a little bit. And of course, we work very closely with our federal partners on funding solutions through a variety of programs that the federal government is offering.
This question is from Aaron Prater at the Gazette in Colorado Springs. For the past 4 days, the number of new tests reported each day has more than doubled the daily number for the preceding weeks. It's now around 3,500 per day, where it had been closer to 1,500 per day since the first few days of reporting testing numbers. Should we expect this as the new baseline, and what's allowed the increase?
This is Scott Bookman. There are any number of different factors that play into this. First of all, we've had some big data dumps from some large national labs that have skewed some of our daily numbers. We continue to do all that we can to expand our testing capacity, working with the National Guard, working with our local public health agencies. The governor has set a bold goal of 10,000 tests per day, and that is what we are aspiring to in the coming months.
I'd like to acknowledge that Shelley Bradbury at the Denver Post had also asked about contact tracing, which we've already addressed. Blair Miller at Denver 7 has a question. What are public health or EOC officials doing to try to understand and mitigate the disproportionate effects of the virus is having on people of color in Colorado?
So this is Scott Bookman. As we look at how this virus has impacted our communities, we are aware of a long history of health inequities and the challenges in accessing healthcare. The governor has asked Webb Brown of our Health Equity Office to lead an effort to improve access to care for all.
This question is from Michael DeYoana with KUNC. This is a question that we've already answered. Do all nursing homes and other facilities have PPE needed? So thank you for that. John Daly with Colorado Public Radio. In terms of testing, is there a certain benchmark on the number of tests ideally that the state needs to hit, both for limiting the disease and for opening up the economy as much as possible?
This is Scott Bookman. That number is a moving target. We are continuing to look at the guidance that comes from the CDC, but we are, as I said earlier in this press availability, we're really shooting for a number of 10,000 per day as our long-term target. We're going to do everything we can to just increase that number to make sure that we have the testing needed to understand the movement of the virus throughout our state.
This question is from Ray Bichelle with Mountain West News Bureau and KUNC. What do you know about the impact of COVID-19 on infants and kids getting vaccinated against the usual vaccine-preventable diseases? Is a drop in vaccination a concern that the health department is preparing for?
This is Scott Bookman. That's a very good question. I'll need to take that back to the team to get a better understanding of the right answer to that.
This is from Ellis Arnold at Colorado Community Media. I've gotten emails about a local health organization operating testing in Aurora and Wheat Ridge. First, do test sites operated by local entities have to only test groups prioritized by CDPHE, like hospital patients, medical workers, vulnerable patients, etc.? And second, is there a comprehensive list of all the testing sites in each county in the state?
This is Scott Bookman. The guidance is still on that tiered system, given that there is still restrained access to all of the necessary testing supplies. We need to save testing for the most vulnerable at this time. As the supply chain opens up and we have more availability, then we will have greater access to testing for those who need it. And our innovation response team is working with the state lab and our local public health agencies to develop a comprehensive list of where testing is available, and then we are going to work on making that available electronically.
This question is from Vinny Del Giudice at Bloomberg. Is Colorado using AirBridge for supply delivery? Who owns the supplies when they arrive in Colorado? Distributors for auction or the state?
That's Mike Willis. So the AirBridge program is a joint effort between FEMA and the private sector. FEMA helps bring PPE in particular that the private sector has purchased from Asia. They fly it in and then they turn it over to the private sector for distribution. Once it reaches the United States and it's given to the private sector, they fill orders through their commercial supply chain directly with their customers. The Office of Emergency Management and FEMA don't participate beyond that point of it arriving. And so it's a good thing, right? It's helping reestablish the normal commercial supply chain, but it goes to those private sector folks who bought it.
I'd like to just remind everyone too that we also have Patty Salazar, who's the Executive Director of the Colorado Department of Regulatory Agencies on the line. So they oversee a lot of the different business industries, not all, but a lot of those in Colorado. So if you have any questions that pertain to that you would like answered, go ahead and submit those. Typically, I take these in the order that they're received. I might scroll down this time and look for some of those questions if you have those submitted. So I just want to remind everyone that she's also available to answer questions today. So I'll give you all a minute to submit more questions if you have them. This next one is from Evan Weilach at the Gazette. Why has CDPHE not made its Tableau project available as a data download so anyone can get the data for all of the visualizations there, which are not available as data in the case summary data files? Thank you for that question, Evan. I'll take that back to the team. Okay. So I have a question for Patty. I did skip ahead a little bit, everyone. So again, deviating a bit from our general process, but this question is from Colleen Slevin at the Associated Press for Ms. Salazar. What guidance have you given to hair salons planning to reopen on Friday? How can they safely do this work?
Thank you for that question. This is Patty. So hair salons and other folks that are within the personal services realm are able to open their doors on May 1st with certain restrictions that must be applied in order for them to operate. There is a appendix within the public health order that we are asking for folks to review, and that includes specifications around mask wearing. Not only is the person that is providing the service expected to wear a mask, but we're also asking the clients to wear a mask as well. And that if the individual client coming in is unable to have their own mask, that the professional service provide that to them in order to promote strict hygiene requirements. We are also planning on issuing more industry-specific guidance in the coming days to this field. But again, we are recommending that folks familiarize themselves with the guidelines that are posted in the Safer at Home website so they can open their doors to certain restrictions come May 1st.
All right. A question from Vinny Del Judas at Bloomberg, also for Patty. What will restaurants look like when they reopen again? So Patty, I think this is correct, but Dora doesn't oversee restaurants. Is that right?
Correct.
Okay. Another question for Patty from Blair Miller at Denver 7. President Trump is expected to sign an executive order today to use the Defense Production Act to mandate meat processing plants to stay open. Does that authority supersede state authority? Not sure if that would apply to DORA or CDPHE.
Correct. We do not regulate processing plants. I believe that would be more appropriate for the Department of Agriculture.
This question is from Lori Lizarraga at 9 News. We know business owners are being asked to be responsible, but if businesses aren't, who will enforce the rules if they decide to open? If the state sends cease and desist letters that don't arrive until after May 1, when businesses are already allowed to open, what impact will they have at that point?
Thank you, Lori, for that question. So I want to remind everyone that on May 1st, certain services are able to open, and that includes personal services with certain restrictions. On May 4th, offices can resume, assuming that they are adhering to certain requirements. So we are asking for citizens to not only contact the state if they are witnessing or businesses that are in violation of the public health order, but to also contact their local health authority. This will help us ensure that we are maximizing compliance across the board. I also want to note, in the event that a letter is received after the fact, they still may be, a business in violation may still be required to respond to the state regulator and may still be subject to discipline on their license depending on the nature of the complaint. I can't, did I answer that question? Sorry.
Yeah,
I noticed another piece on Lori's note. If you don't mind, I would also like to address some of the pieces that you had also expanded upon after Lori with respect to the number of complaints. While I can't speak to the statewide number of complaints that are under the stay-at-home order, I just want to reiterate that compliance is going to be key under the Safer-at-Home order, and we will take all the appropriate action necessary to ensure compliance.
This question is from Michael DeYoanna with KUNC Public Radio. What is DORA recommending for nursing homes ahead of the amended public health order that goes into effect on May 1st?
That would be a more appropriate question for CDPHE, which regulates nursing homes.
Yes. Okay. All right, so we've got a couple of moments left. I'm just going to go ahead and start taking questions. I'll try to take them in order again, unless we have any others for Patty pop up. Oh, Lori had a follow-up. She says, thank you, Patty. Has the state received any complaints about businesses reopening yesterday in defiance of the state's public health order? Have cease and desist orders been issued?
Again, I can't speak to complaints since they are considered confidential in nature. But at this point, I can say, at least under the Safe at Home order, that we have not issued any actions as of yet that are considered public.
Okay. Thank you, everyone, for bearing with me as I go back to try to find my spot where I was at before when we switched to DORA questions. Thank you for your patience. Okay. So this was a question that Lori at 9 News had submitted. According to John Hopkins, Colorado is listed 25th in testing when compared to all other states. We know the state is working to ramp up testing, but in the meantime, there are testing sites that are popping up. Are these independent antibody and COVID-19 tests approved? Are they reliable? And are those testing results being included in the state totals?
This is Scott Bookman. As far as the serological testing goes, we are looking for a separate pathway to report that information, since it is a different result than what we get from the nasal swab RT-PCR testing. So as we start to get that information, we will report it in a different manner. We are also working hard to understand the evolving science around serological testing. We have a team that is dedicated to analyzing all of the different tests that are out there so that we have an understanding of what this data means.
This question is from Marianne Goodland with Colorado Politics. Does CDPHE have the authority to direct Weld County Public Health to cite violations in Weld County, which has ordered less restrictive measures?
This is Scott Bookman. Again, first, we really want to just stress the need for voluntary compliance here. We are in this together as a state. We need to take care of our neighbors. We need to take care of our friends, and we all need to do the right thing. We are early in this pandemic. We have a long way to go. We need to work together as a community to achieve success. The more we work together, the better chance we have of continuing to open things up so that we can live our lives together. We encourage people to make reports to their local public health agencies and to the Attorney General's office if they have concerns about people who are violating the orders.
All right, well, that takes us right up to 11:30. So before we sign off, I'll just have everybody say and spell their name and repeat their title for you. So Patty, would you start us off?
Sure. Patty Salazar, P-A-T-T-Y-S-A-L-A-Z-A-R, Executive Director of the Department of Regulatory Agencies.
Thank you.
Scott Bookman, S-C-O-T-T-B-O-O-K-M-A-N, CDPHE Incident Commander.
Mike Willis, W-I-L-L-I-S, Director of the Office of Emergency Management.
All right, and just a reminder, everyone, too, the best way to stay up to date on media availabilities is to be on our list. And so if you're not already on there, please email media_info@state.co.us. Thank you so much for joining us. Have a great afternoon.